Plans are in place to help keep residents safe from coronavirus, but some of Chicago's most vulnerable citizens have been left out. For more on this, now we turn to Neli what's your last name?
Rowland.
Vazquez Rowland.
Thank you.
Exactly.
I'm sorry.
No, that's okay.
John knows me.
Yeah, thanks so much for being here. We appreciate it.
Yeah, I think that as a lot of us have options in terms of quarantining and staying away from other people, but we often forget about the homeless population in our city. Are there any plans in place to help some of those folks?
Well, we've been planning this for a long time and working on it for a long time, celebrating 25 years actually of working with the homeless populations. And every winter, we prepare for flu season. So what we're doing now is basically doubling down on that. And our facility actually houses 400 homeless people at any given time, and we're always full. And we are concerned because, as we know, if a homeless person comes down with the coronavirus, that would be devastating to a homeless shelter. It will be devastating to a tent city. It will be devastating to all of us because they're in the public space, right? They're on transportation systems. They, wash up in Starbucks and McDonald's. And, I think that we really need to have an all hands on deck, approach to really tackling this homeless issue in the first place. And now more importantly, because we are extremely exposed to, the repercussions of the homeless getting this coronavirus.
I would imagine, too, a number of the homeless people that you work with have underlying health problems as well from being out on the streets for a while.
Yeah, they definitely suffer from malnutrition issues, compromised health issues, immunity issues, and age, as well, and as long-term substance abuse issues affect their health in many, many ways. So they are the most susceptible, the most vulnerable population that, something like the coronavirus could really, devastate their lives.
Now, Neli, we're talking about a problem that's been in Chicago for years. This is a problem that we've been seeing ever since I've been growing up, obviously, and many years before that. What would be the start? What does that solution look like? Can we start working toward a solution?
I'm hoping that the silver lining of this will help us really come to terms and a reckoning with the homeless situation finally. We started this organization with the concept of thinking about that exactly. How do we address the homeless issue by addressing the underlying issues, getting them first and foremost in a place to live that's conducive. For example, at A Safe Haven, we have semi-private suites, right? They're not out in cots. They're in bedrooms pretty much with a roommate, and they are more than 6 feet apart, now that we think about it. So it really does give them back their dignity. And under one roof, we have a 140,000 square foot facility. Under one roof, we provide shelter, semi-private suites. Like I said, a mother can be in a room with her children, offered privacy. We have the ability to serve them 3 healthy, nutritious meals a day. We also assess them to find out what are the other coexisting conditions. Do they need drug treatment? Do they need education? Do they need job training? And we get that all done under one roof. And last year, for example, we've housed throughout our system, we have other facilities with supportive housing as well, about 5,000 people a year. And the vast majority of people that we serve do get back on their feet. They get jobs and they get access to apartments.
Let me ask you this. Have you been in contact or has any government officials reached out to you? Because it's going to be devastating for the city of Chicago as well if this starts spreading amongst the homeless population.
Yeah, we are getting emails, with instructions of what to do, such as, recommending frequent hand washing, things that we normally do anyway. What we're realizing, though, is that much of the bill that passed out of the $8.3 billion, not much of it or any of it is being dedicated to go to homeless shelters. I believe there needs to be dedicated funding going straight to the front lines. We can't wait. We have this right on our doorstep right now, and I believe that we've got to carve out some funding, and if the government isn't going to do it right away, then we've got to encourage private donors to really think about, this has been a poverty situation of homelessness that's suffered from stigma for many, many years, and that's kept it from being a mainstream charity type of, giving.
Has there been any communication with the homeless population? Because, look, we're inundated with this information here. Are they,
Yes.
it depends on each case, but giving them the information that they need about what's happening in the world.
Right.
Yeah, well, there's groups that are going out there. There's outreach groups that are going out there and giving that information.
Okay.
And constantly, we are under our, purview. We have them, and we're constantly educating them and helping them practice sneezing in their elbow and things like that. So hygiene is really important to us at A Safe Haven, and that's not something that they get on the streets. If you want to see the worst case scenarios in terms of hygiene, it's the homeless living on the streets.
For sure. All right, a Safe Haven has always been helping people out. Thank you so much for stopping on by. We appreciate it. And they're always in need of donations too. You can also sign up for their 5K run walk, which is scheduled for July 19th to runtoendhomelessness.org. And Nellie's has a book coming out in May. Also be on the lookout for that. Thanks for stopping by.